Hi guys, welcome back to the channel. I'm sat here again today with Dr. Kishan and we are going to be talking about hair loss and what you can do about it. Ah!
Okay, we've both got luxurious hair. I'm sure our audience is used to. No, I'm just joking.
So you look like you've got a very full head of hair.
Well, I'm no stranger to treatments, and we're going to fess up a little bit later about what things we've tried to improve hair growth. We've talked about the top causes of hair loss, and now I think it's time we did something about it. So really the first step is finding out exactly what type of hair loss you have, and just because you have one, it doesn't mean you can't have another. So we have to identify exactly what type of hair loss you've got, and then if it's more than one cause, we will treat it concurrently.
I'm sure you're all dying to know what the natural options are for hair loss.
Yeah, of course, they should be dying because these are things you can do at home. Organic first, physiological measures first. If stress is your big problem causing your hair loss, we've got to manage your stress. I personally use heart math. I know I got you a heart math for Christmas. Yoga is great, breathing techniques, breath counting, all sorts of things you can try, whether it be swimming or exercise or running or walking. Whatever mitigates your stress is going to have a positive effect on your hair growth, if stress is a big player in your hair loss. Speaking of yoga, inversion poses in yoga increase your circulation to the scalp massage, lymphatic drainage, chiropractor treatment. All of these things improve blood flow to the head and neck, and that can improve your hair growth. For those of you who like natural oils and aromatherapy, there's been studies in the naturopathic medicine literature, so rosemary, peppermint oil, castor oil, all of these things can be applied to the scalp and they improve blood flow as well, but they have their own mechanisms for improving hair growth. These are things you can try. One side point is, if you're going to use any of these oils, try not to use them in plastic bottles, because plastic bottles will leach out endocrine disruptors, hormonal disruptors into the oil, detracting from the benefit of what you're doing with those oils. Obviously, improving your nutrition, trying to incorporate as many antioxidants, having a plant-based diet with some quality protein, quality fats, that's all going to impact on your hair health as well. In the naturopathic literature, there's also been various herbs and supplements which have been recommended, and some of the ones that have better scientific support include saw palmetto. Saw palmetto in doses of anywhere between 300 to 1,000 milligrams, curcumin, resveratrol and reishi mushroom. All of these things have had some support in the scientific literature. There's been many other herbs and supplements recommended anecdotally, but the scientific evidence behind them is a little bit weak, so I'm not so thrilled to recommend them personally. Some of the simpler measures we can try are making sure that your shampoo isn't too acidic. We want your pH of your shampoo to be slightly alkaline. Avoid excessively tight hairstyles, and also maybe look at some of the products you're using. If they don't serve you, then try to opt for slightly different, more hair building products as well.
I think what people are really here for is to know about what drugs they can take.
They're here for everything, Sarah. But drugs, let's talk drugs. Okay, well, the top most evidence-based, or that means like the most researched and most successful treatments in science for hair loss have been minoxidil, and the other one is a DHT blocker, or a 5-alpha reductase blocker called finasteride, sometimes it's called Propecia, and dutasteride, which is known as Avodart. They are the top treatments for hair loss. After those, we've got supportive things, so things like latanoprost, which is a prostaglandin analog. Also, hormones used topically or sometimes systemically can be very, very beneficial in improving hair quality and growth. So progesterone, estrogen, and things which modulate testosterone can be very beneficial. And when I have a hair loss patient coming to clinic, I'll basically try to select different things that will support the top therapies. So these other things can be things like spironolactone. It's an anti-androgen which works on the scalp to prevent hair loss. Caffeine can improve blood flow. Tretinoin, and even melatonin is a really useful hormone to use in our topical formulas to promote hair growth.
Does that not make your hair tired?
Oh, that was really funny.
Kish, what are we aiming for with hair loss treatments? Are we going to get our full wig back? How does it work? Okay,
let's be realistic. I think the main thing is that we try to arrest any further hair loss by identifying what the problem is and treating appropriately. We want to regenerate new hair growth. So if your follicles have been dormant for less than 15 months, the news is good. There's a good chance we can regenerate those follicles and get hair growth healthy again. If it's longer, unfortunately, hair loss tends not to be quite so easily reversed. And the other thing that we're doing is that we're trying to optimize the scalp so that if you decide to have something like a hair transplant surgery, whether it be FUT or some other method of hair loss surgery, we can optimize the health of your scalp so that the results will be much better, much more predictable. If you do decide that you would like to have a hair transplant surgery, the results of it can be a little bit unpredictable. And the reason is that the same problem that caused the hair loss in the beginning is still present even after the surgery. So that's why the success of these treatments is a little bit variable.
So it sounds like we've got some decent options. What are the chances of success with these pharmaceutical options?
Okay, so the top two were minoxidil and finasteride because they've got the most evidence behind them. Unfortunately, everyone's different, and that's why, trying to base these decisions on scientific literature is pretty much what we've got at the moment, but it's about 60%. Now that can seem a bit underwhelming, which is why we've introduced something new and very exciting to the clinic.
Trichotest! It's the Trichotest! As you can see, I'm maybe more excited by that than you are.
Okay! So it is the Trichotest, and I am really excited about it, but maybe not as much as her. But Trichotest is something of a new paradigm shift, because if you came to the clinic before, what I would have done is I would have basically, it's almost like playing chess, I would have tried to find a formula for you that would not provoke allergies, not have too many side effects, and would give you the results in terms of hair regeneration. The problem is it's almost like sticking my finger up in the wind and saying, let's try this top treatment, that top treatment, let's give you some supportive treatments. It's like an educated guesswork. With our new test, which we're going to talk about in the next video, it's much more about personalised precision medicine. So we're going to be talking about Trichotest in the next video. Hope you can join us. Thanks for watching today. I hope you enjoyed it. And don't forget, like, share, subscribe. Bye.